I had some hair loss after 5 days of my PRP therapy. After 5 days of my first session of PRP therapy, I felt I lost some hair in some parts of my head. Is that normal? Now it's been a month and I haven't lost any more, but the situation didn't get any better. I still have 2 sessions left and I'm so concerned about it. Is that normal? Thank you all.
Thank you for your question. You state in your question that several days after a PRP injection for hair loss, you had some hair shedding, and that a month later you don't see any improvement and you have 2 more sessions left. And so you want to get some guidance as to whether or not this is of any benefit. Well, I can certainly give you some guidance with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I'm also the founder of Trichostem Hair Regeneration Centers, a system we developed in our practice where we use PRP as well as a material called acellular matrix to help men and women from around the world with male pattern hair loss. I've been in practice over 20 years and we use PRP in our practice every day. So, understanding current thinking about the role of platelet-rich plasma with hair loss is probably helpful to you, even though I'm sure this was already explained to you by your doctor before you made this decision to have this treatment. So, I'll tell you what it has been essentially the experience of a lot of our patients who come to us who've had PRP done elsewhere, and what my perspective is from personal experience as well as how we use PRP with our treatment called hair regeneration. So to begin with, it is generally agreed in the hair treatment or hair loss specialist community that platelet-rich plasma has some benefit for hair loss. And articles are starting to come out that show certain specific objective data to support this. However, it has been my experience that platelet-rich plasma for hair has a limited value. And what I mean by that is it does appear to have benefit. It can cause short-term growth of hair. However, long-term, beyond the point of injection, let's say a year after the injection, I don't think it makes that much of a difference. From patients who have come to us for hair regeneration, they'll state that they've gone for PRP treatments monthly, and around the 4th month, on average, they felt like they just didn't know where their endpoint was going to be. So they stopped going and they learned about hair regeneration. With our treatment, which we developed over several years based on a wound healing technology that we were using for hair transplant surgery, we're able to treat with a single treatment not with men and women with genetic pattern hair loss. We have 99% success defined by the simple criteria of stopping progression of hair loss, reactivating hair that is not growing, inducing the shed of thinning hair so thicker hairs grow in. We follow our patients every 3 months and we have years of data to the extent where 5 years out people are still not regressing. So PRP is a very useful treatment in the world that we inhabit, which is not only hair loss, but in the field of cosmetic medicine, cosmetic surgery. We use PRP for acne scars, for under-eye dark circles, for pigmentation issues, for a lot of ways that can help improve tissue, improve blood supply, improve collagen. But when it comes to hair loss, I don't recommend PRP as a standalone treatment. Now, that doesn't mean that a colleague who is recommending it is wrong. They may feel that in their hands, PRP does have benefit, which with a certain schedule may be of value to you. So I don't think you want to necessarily abandon hope, but meet with your doctor again when you are ready for your next session or maybe prior, and ask about what is the long-term benefit. I think that a lot of times people think all PRP is equal, and thanks to the time that we've put in with hair regeneration, we are basically seeing an incredible amount of growing awareness because of the success. And on top of that, the people who we've treated, their friends, their family, and their network of awareness is also increasing. So it's now a little bit more complicated in that it's not just PRP alone, it's PRP plus acellular matrix and other things that we do specific to trichostem hair regeneration. So don't just stop your treatments. Talk to your doctor, learn about your options, learn more about alternatives, and see what else makes sense for your situation. So I hope that was helpful. I wish you the best of luck. And thank you for your question.